Good afternoon, everyone. Nice to be back with you on stage. That was a fantastic conversation. I'm so happy to have heard Paul Farmer's name invoked on this stage multiple times. It's great to have listened to that discussion. I'm joined by Caroline Roan, who I think many of you know, and know that she's a woman who kind of does it all.
Well,
and now I have proof because she's got a series of new titles. Caroline is the Chief Sustainability Officer at Pfizer. She's also the Senior Vice President for Global Health and Social Impact at Pfizer and the President of the Pfizer Foundation.
It's great to see you, Raj.
It's great to see you. I've barely seen you as anyone has because it's been an incredibly busy time.
It has. It sure has.
We've been on this stage multiple times in prior years talking about health systems.
Right.
And I feel like the conversation is starting to evolve. What are some of the lessons you're taking away from the moment we're in now, the pandemic, et cetera, that make you think about health systems in a different way? And then I want to talk a little bit about what you're doing about those things.
Sure. Well, first, I always want to start as I put my toe back into in-person events, which I know all of you are doing, to say thank you to the healthcare providers, the community healthcare workers that were referenced. They've taken care of us. They always do. And they all need a round of applause. So let's start that way. So I think the conversation was very timely. You know, what we did see in the pandemic, many of the issues alluded to in the previous conversation from a Pfizer perspective, is that the systems of care, whether they're in high-income countries or low-income countries, really were struggling, right, to deal with what the world faced. And I think we've always had a longstanding series of investments in strengthening that system of care, particularly for those populations that are disproportionately impacted against, inequities overall in low resource settings. So, we could spend some time today talking about that, but I think as we think about the lessons learned, we have to invest in primary healthcare. We have to invest in community healthcare workers, the people who are on the front lines, in surveillance systems. Otherwise, it's going to be another COVID-19 pandemic the next time around.
Yeah, this is a theme I hear from a lot of companies in the pharmaceutical space who I think a decade, maybe 2 decades ago, saw their role principally as doing innovation.
Right.
They thought of themselves as scientists. And then what they found is they put products out there on the market, and sometimes it was hard to actually address the disease burden they were targeting, not because the medicine wasn't there, but because the systems weren't there.
Right.
And they find themselves having to expand in ways they never did before. And I think we've had a discussion now, probably the last decade, about health systems and how everyone has a role to play there. I think that conversation has started to shift to health systems and equity.
Right.
To your point.
Right.
I'd love to hear a little bit about more of what you're doing at the Pfizer Foundation with that hat on.
Sure.
To kind of drill into some of these issues where equity and systems come together.
Sure. And I should say, to your point, our core is discovering, developing, and bringing to market medicines and vaccines. Full stop. That's what our core competency is. But as you said, we know that without strong systems, those medicines and vaccines aren't going to get to the patients who need them. And so the Pfizer Foundation, and I should say for those who don't know, the Pfizer Foundation, founded in the 50s, very much started doing local-based work here in New York City because that's where our corporate headquarters are. And fast forward, as the company grew, our global footprint grew, and we've really leaned into health system strengthening through the Pfizer Foundation's activities. And actually in 2018 into early 2019, we launched a new focus on strengthening the systems of care in infectious disease. And it was interesting. It was called the Pfizer ID Impact Initiative. And it was really designed to do just that, right? Strengthen care and treatment for infectious diseases. And people said, why is Pfizer doing that, right? Because our most recent history had not been in a pipeline of infectious disease. We had it early in our history. And similarly, I think people were talking about the dual burden, the growth of non-communicable diseases, and we had a strong portfolio in that space. But we said, no, the work is not done. And thank goodness we said that, because we've benefited from having that program in place. Just to give you a sense to the audience of what types of programs we've supported, Save the Children has been a longstanding partner. They have a program in Kenya that, of course, was designed to support babies getting the vaccinations. And as we all know, those have fallen down in the time of COVID, routine immunization. Mom brings baby in, and traditionally wouldn't be a set of comprehensive services provided. And what we worked with Save on was to really integrate that comprehensive approach. What are the risks? What is the family facing? What is a mom facing? Can we provide additional services and support and education? And what we found in that program that was operating both in Nairobi proper and also in the rural areas was that during COVID, they were able to expand quickly to provide education about the spread of COVID, which was critically important. Fast forward to the whole impact initiative that we started, which does cut across the company. We trained about 40,000 healthcare workers and strengthened about 4,000 clinics through the program out of the Pfizer Foundation.
That kind of training, if for those of you who are here this morning and may have heard a bit about this, could be particularly critical now. You refer to the drop-off in vaccinations for children. It's now 25 million kids who have missed out on their essential childhood vaccinations.
Right.
And that drop-off, Atul Gawande, who's the Assistant Administrator for Global Health at USAID, was here on the stage earlier saying it's not going to be a V-shaped recovery.
Right.
It's going to be a long road. And part of that are things like training healthcare workers.
Right. And also providing incentives and support for moms, right, when they bring their babies in. So it's not just taking a day off of work to bring your baby in to get a vaccination. It's also providing other healthcare services. So I think we've learned a lot as a global community about how to do that work, but it's a long road ahead of us to get back to routine immunization for sure.
Yeah. And one of the other themes that we've been talking about today is, we often, as a global health community, we think about verticals, disease verticals. Mm-hmm. We think about health systems, cross-cutting, and projects that help to strengthen them. We're also talking a lot today about community. And we heard a bit about that in the last panel too. Mm-hmm. How do you think about working directly with communities as your core interlocutor as opposed to just governments?
Well, when we think about our work, we do work directly with governments. We do work with the more traditional international NGO. But to your point about communities, what we found over the course of our work through the Pfizer Foundation is that, it's basic. Local problems need local solutions. And the way that you get that is through funding local entrepreneurs. Many entrepreneurs have seen a fractured healthcare system in their community, and they've said, I've got an idea for how to solve that. I need capital, I need skills, I need support to expand my idea. And we launched the Global Health Innovation Grants Program. It's one of my favorite. I know we've talked about it. I know Devex has covered a lot of our grantees who they're real heroes in this story. But to give another example of that type of work, very, very different than SAVE, North Star Alliance is an organization that operates blue box clinics. So they're basically shipping containers that were converted to provide healthcare services along trucking routes because truckers were disproportionately at risk for infectious disease. What we love about this is it was a small program. We've worked since 2016 with them to expand their reach. And if you can imagine, these are literally branded blue boxes that dot the trucking routes in East Africa. So if a trucker is driving along and needs healthcare services, they can stop. They can be rest assured that they're going to get quality care and be treated for what they need when they need it. And in just this entrepreneurial program, while not the largest grants we make, we believe it drives the greatest impact because it is fully owned and sort of operated by the local community. And in this context, we've reached about 2.5 million patients and trained about 10,000 healthcare workers. Similarly, we're able to use that network to drive education and awareness about COVID-19.
And that connection point, I talked to a lot of social entrepreneurs in the global health space, and they have a really hard time getting from the concept phase to getting that first set of grants that gets them over the hump to actually show some proof of concept. And then the key issue from there is scale, which there's still a big gap on the impact investing side, investing in these kinds of programs. But there are many promising entrepreneurs out there who are trying to solve these issues.
For sure. And that's where we see the beauty of kind of having a portfolio approach out of the foundation. We want to support our international NGOs, but we also know these entrepreneurs play a critical role in the future of how we both take on pandemics, but more importantly, primary healthcare services.
Yeah, and those healthcare services for the most marginalized communities, right? Which is another theme we've been talking about on stage all day about how do you bring equity, which is the theme here, into health systems. One thing we've learned, I think, from the COVID pandemic is how hard that can be when you need to reach everyone.
Right.
You know, how do you find the groups that are being marginalized by the health system in their country, and how do you get to them?
How do you get to them? And I think in that context, imagine truckers, right? I mean, and in this context, North Star serves commercial sex workers as well. These are not folks that have traditionally been treated and welcomed always in traditional healthcare settings. And so, you know, the sort of philosophical approach is everybody deserves a dignity, you know, right, when they come in and they have a healthcare issue and they want to solve it. And that's really been the entire mission of the Pfizer Foundation since its inception. And certainly as we moved into the system strengthening component, we also do that work on the corporate side as well, as you know.
So I think we just have a minute left. Maybe for people who are here and those who are following along, who are interested in how they could work with the Pfizer Foundation, what are some of the other things you're doing? What are some of the entry points for those, for the next, you know, organization looking to serve truckers or other groups?
Sure. Well, we're staying the course with infectious disease work. So we're going to continue our ID Impact initiative. We're doubling down on vaccination, as you alluded to. This is going to be a huge issue to get back to standard immunization. And then I'd like to put a plug in on the corporate side for what we've done around closing the health equity gap. Back in May, Pfizer announced a commitment to provide 23 medicines and vaccines to 45 low-income countries at a not-for-profit basis. And this commitment was really born from lessons learned about the equity gap in COVID. And this is a significant effort. These are all medicines and vaccines currently available in the US and Europe to close the gap, because we know that it's about 4 to 7 years that there's a delay in the time that a innovative medicine or vaccine reaches a low-income country. So we launched the Accord. 5 countries have initially signed up with us. And I'm proud to say that since May, we have already got our new COVID-19 therapeutic in Rwanda, as well as our innovative oncology medicines, and they're making their way to public hospitals right now. If you're uptown and you're around the UN headquarters, please stop by 42nd and 2nd. We've wrapped our building with information about the Accord. Really is a commitment to demonstrate how seriously we take closing that equity gap.
I look forward to seeing you there tomorrow. And I thank you for being here today, and thank you and Pfizer for your partnership and support for the UHC Pavilion. Thank you, Carolyn Roan.
It's great to see you.